So move on to interferons. So like I mentioned for cytokines, when you hear interferon gamma, all right, your number one condition, TB. TB until proven otherwise. It and as well as interleukin 12. Okay, so these two, interleukin 12, interferon gamma, TB, all right? And we said from yesterday, from the other day, for when we looked at cytokines, interleukin 12 comes from the macrophage. Okay, we said there are two main sources of cytokines, like this for your step one, that are looking at that table. Two main sources, macrophage and CD4. Now, with interferon gamma comes from CD4, TH1, all right? Interleukin 12 from the macrophage. So the macrophage produces your interleukin 12, all right, as it's presenting antigens to, let me show you the image. Okay. So, well, did I? Yeah. So your macrophage produces your interleukin 12 while it's presenting the antigen to the CD4 T cell. Okay. That you can see here. Okay. So look at your macrophage here. All right. Look at your CD4. This is CD4 T cell. Okay. So I said there are two main sources of your cytokine, CD4 T cell as well as your macrophage. So the macrophage is producing the interleukin 12, all right, to the CD4. And you need to know that interleukin 12 coming from the macrophage because one of the immunodeficiency conditions involves this interaction, which we'll look at later, right? So once this cell becomes activated, it will now produce interferon gamma, okay, that would now stimulate, activate the macrophage, right, like we're seeing here. So look at interferon gamma produced by the TH1 cell. Once it activates the macrophage, okay, this is the one that now goes on to kill the macrophage as well as recruit other white blood cells that will form the granuloma. All right. So when you hear granuloma, all right, with in some cases can have central necrosis, but granulomas, one of the most common important conditions that causes granulomas is TB. All right, and you need to know that TB has to do with the interaction between the CD4 and the macrophage. All right, and those the two main cytokines. So two cells, all right, macrophage, CD4, two cytokines, interleukin 12, interferon gamma. All right, so that's TB. So when you think of TB, two cells, macrophage, CD4, two cytokines, interleukin 12, interferon gamma, mostly one outcome, uh, granuloma formation. Okay. All right. So, and then this other two, interferon alpha, interferon beta. When you think of those two, mostly viral. Okay. So these two are for viral infections, right? And then what do they do? Once a cell is infected with the virus, it produces these interferons. And the interferons, what they are supposed to, from the word interferon, interfere, like they said, interferon will interfere with viruses, with viral replication. So the virus that is infected, the cell that is infected with the virus, produce interferon to sort of warn other cells. Okay, let's see if we have an image of that to disrupt the 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 production when the virus leaves that infected cell to the other cells. The interferon that is produced here, as you can see. Okay, so the cell that was infected with the virus produced interferon to warn these other cells about the presence of the virus. So the next time the virus gets into the other cells, it will be unable to carry out viral replication. Why? Because the unaffected cells will be able to destroy the RNA or the nucleic acid of the virus, destroy the nucleic acid, and also reduce protein synthesis in the neighboring cells. All right. Or the second thing it can do, so this is the number one effect. The number two effect is it to induce those neighboring cells or neighboring infected cells to undergo apoptosis, and then it can also activate immune cells. For example, your natural killer cells that will now come there and destroy the virus. We said that natural killer cells are one of the cells that are involved in destroying viral infected cells or tumor cells, right? So those are some of the effects of the interferons. So interferons from the word, they interfere with viral replication, right? So interfere with viral replication. So, and they are part of the innate host immune response. Okay, so like I said here, cells affected with the virus will synthesize this like protein that will act on neighboring cells, priming them for viral defense by down-regulating or reducing protein synthesis to resist viral replication and up-regulating MHC expression. Right, so that's in a neighboring, or that's to facilitate recognition of the infected cell. So that's when it upregulates MHC, particularly MHC1. Okay, that's recognized by CD8 positive T cells. So we say CD8 are natural killer cells. So the interferons we call the natural killer cells. The MHC1, okay, will stimulate the CD4 positive cells. So the interferon alpha and beta will stimulate the natural killer cells. So all of that is what's the endpoint? To kill the virus infected cell. Okay. Then the other thing it will do is, like we said, is stimulate the neighboring cells to down-regulate protein synthesis of the virus. All right. So also said it plays a major part in anti-tumor immunity. So anti-tumor by this in the sense that they will also stimulate natural killer cells. Right. So the tumors, once the patient has a tumor, they will produce those interferons that will stimulate natural killer cells to go out there and destroy the cancer cells. So what are the clinical conditions where they use them? Viral hepatitis, okay, particularly HBV, we have Kaposi sarcoma, all these other conditions that you can use the interferons to treat. And then these are the side effects: flu-like symptoms, depression, neutropenia, myopathy, interferon-induced autoimmunity, and so forth. So before I move on, any questions? Any questions on this?